Hi everyone, today we are going to talk about gynecology history taking. Points in history taking. First, we will talk about introduction in gynecology history taking, then personal information that are taken in gynecology history taking, presenting complaint, then history of presenting complaint. We will talk about medical menstrual history, obstetric history, gynecological history, sexual history, past medical and surgical history, family history, social and lifestyle history, all of this in gynecological history taking. And also we will review the same systems. Points in history takings. First we will start with introduction. Gynecology history taking is fundamental part of clinical practice and involves gathering detailed information about a woman's health, reproductive system, and related medical condition to aid diagnosis and management. Points in history taking. First step is personal information. In this, basic demographic details such as age, marital status, occupation, and lifestyle habits are recorded. These factors often influence gynecological health and treatment options. Second step we do in history taking is talk about presenting complaint. It is a main symptom or concern that brought the patient to the clinic and it is noted. Example include abnormal bleeding, pelvic pain, infertility or vaginal discharge. Third thing we do in vaginal gynecological history taking is history of presenting complaint. It is a detailed account of onset, duration, severity and progression of complaint is taken. Associated symptoms like fever, urinary problem or GI issues are also explored. At fourth step we do the menstrual history and gynecological history taking. In this include age and menarche, cycle length, duration of flow, regularity, amount of bleeding and any associated pain. All the information are collected during menstrual history. Menstrual abnormality often provide important diagnostic clues. At fifth step we do in gynecological history taking is obstetric history. It is detail of previous pregnancy, outcomes like live birth, miscarriage or stillbirth, and complications and mode of delivery. All of these things are documented. This helps in assessing fertility and risk in future pregnancy. At sixth step we do is gynecological history, in which past gynecological conditions such as fibroids, ovarian cysts, endometriosis or pelvic infections are noted. Previous surgeries or procedures like hysterectomy or IUCD insertion are also relevant in this history. At seventh step, we talk about sexual history of the patient, in which information about sexual activity, contraception use, history of sexually transmitted infection, and any sexual dysfunction is obtained sensitively and confidentially. At eighth step, we do is past medical and surgical history in gynecological history taking, in which chronic illness like diabetes, hypertension, and thyroid disorders and also previous surgeries are recorded, as they may impact gynecological health and treatment choices. At ninth step in gynecological history taking we do is family history, that includes genetic or hereditary conditions such as breast cancer, ovarian cancer or clotting disorders that are important to note. Family history can guide screening and preventive measures. And next step we do is social life and lifestyle history. In this we include factors such as smoking, alcohol use, diet, exercise and stress level, and these all things are considered as they can influence menstrual cycles, fertility and overall reproductive health. And at the last step of gynecological history taking, we do the review of systems, that is a systemic review of other body systems like urinary system, gastrointestinal system, and endocrine system, and it is conducted to identify related or overlapping conditions. Conclusion of this lecture video. Gynecology history taking is a comprehensive process that requires sensitivity, confidentiality, and attention to detail. It forms the foundation for accurate diagnosis, effective treatment, and holistic care of women's health. And this was all about gynecology history taking. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.